Hello, Dr. MovingBetter. I'm doing all my therapy. I'm careful with my arm, but my shoulder still hurts. I'm scared to move it sometimes. What if I make it worse?
Hi, Sarah. That's one of the most common things I hear after stroke. And here's the truth. Shoulder pain after stroke isn't a punishment. It's information. Your body is asking for balance, safety, and the right kind of movement input. Let's fix that together using a simple, 4-step relief framework that's easy to remember. Align, calm, activate, and advance. When the shoulder sits out of alignment, every tendon and nerve has to fight gravity. The goal isn't to force motion, it's to create support before strength. Start by checking posture, tall spine, shoulder gently out to the side, forearm supported. Use a small pillow or tray to keep the arm level with the heart. If the arm feels heavy or hanging, the joint may be drifting, what we call subluxation. Every minute the arm is supported correctly tells the brain, this joint is safe. That safety is the first signal for healing.
So it's not just comfort. Alignment actually tells my brain how to move again?
Exactly. When the shoulder is aligned, sensors in the joint send accurate messages to your brain, and your brain can start rebuilding normal control.
Sometimes my shoulder feels tight and pulls inward. Is that spasticity?
Yes, and here's the key. Spasticity is a reflex of protection. Your brain lost part of its control, so the muscles tighten to guard you. To reduce it, we don't fight it, we calm it. Use warmth, slow breathing, and long holds. Place a small towel roll between your arm and body to open the space. Then rest your hand on a pillow, palm up. Stay there for 60 to 90 seconds, slow breathing. This resets the reflex arc. When nerves are overreactive, like in central post-stroke pain or CRPS, we calm them with graded sensory input. Start with gentle, pleasant sensations. A soft cloth, light touch, or gentle warmth. Never chase pain. Instead, teach the brain that touch equals safety.
That's different from what I imagined. It's not about pushing harder. It's about making the brain feel safe.
Exactly. In fact, this is the same neuroscience we use in desensitization therapy for CRPS. When you give the brain consistent, comfortable signals, pain volume turns down, and control starts to return.
To summarize what you've said so far, start with aligning and supporting the shoulder properly. Then, calm the nervous system when there's spasticity. What's next? Activating the shoulder muscles?
Correct. Once alignment and calm are in place, it's time to activate. Not random movement, purposeful movement. Start with the scapula, your shoulder blade. Gently slide it down and back, like parking it in a smooth groove. Then, using your good hand or a dowel, guide the affected arm through its easiest arc. If it hurts, shorten the arc. Quality matters more than range. Breath stays smooth. Eyes stay forward. Each repetition tells the brain, this motion is safe. You can trust it. For soft tissue causes, impingement, bursitis, frozen shoulder, gentle mid-range mobility with heat before and ice after reduces inflammation and stiffness. 5 minutes twice a day beats one big, painful session.
So the goal is rhythm, not heroics.
Exactly. Consistency rewires faster than intensity. Your brain learns through repetition without threat.
We've gone over alignment and support. After that, we went over calming the nervous system and then activating the shoulder muscles in the right way. What's next?
Now you protect what you've built. Keep the arms supported during rest, avoid traction when standing or transferring, and sleep with the shoulder cushioned. Gradually add light daily activities, folding towels, reaching to shelves below shoulder height, gentle isometrics. If pain spikes, step back one layer, align and calm, then rebuild.
And if it doesn't improve, when should someone see a doctor?
Great question. Persistent pain that's sharp, hot, or limits daily life deserves a medical review. Your rehab physician looks for patterns. Is there inflammation or tendon overload? Is spasticity locking movement? Are nerves signaling too much? Depending on that, we might adjust therapy, consider tone management, or use diagnostic ultrasound to look deeper. The goal of medical treatment isn't to replace rehab, it's to unlock it.
That helps me understand why you target the cause, not just the pain.
Exactly. The shoulder heals when movement, mechanics, and mindset work together. That's the foundation of recovery medicine.
Thank you for the information. How do I start applying this?
Sarah, your brain and body are in constant conversation. Every supportive position, calm breath, and safe repetition tells your nervous system, I'm healing. You start right there. The small things you do over time will add up to relief. This week, focus on those 4 words: align, calm, activate, advance. That's your daily map. And to make it easier, download the free relief routine checklist in the description. A printable guide that walks you through these steps with reminders and tips.
That's perfect. I'll share it with my therapy group. They'll love this approach.
Wonderful. Come back for our next video. If there are topics you want, leave suggestions in comments below. Build your weekly plan for motion, relief, and confidence. Be consistent. Remember, your body is wired to heal, and you are not alone.
Restore your body's form through every storm. You'll find the norm, a new beginnings, gentle movement, build your tall, each effort heralds you belong.